Hello everyone and welcome to the part 3 of the video presentation series Basic Principles of Laparoscopic Surgery. The work is catered to MRCS candidates and junior trainees who may find this helpful. There are no conflict of interest and all videos were made for educational purposes only. These are the remaining learning objectives which will serve as a guide and introduction to the basic knowledge of laparoscopic surgery. Do feel free to check out the remaining of the video presentations if you haven't already. Appropriate use of instruments with delicate tissue handling during laparoscopic surgery improves surgical outcome, ensures safety, and reduces complications such as iatrogenic tissue injury. Instruments like tissue graspers, scissors, clip applicators, endoloop, and energy devices are routinely used in procedures such as laparoscopic appendicectomy, cholecystectomy, and colectomy, just to name a few. Graspers are broadly classified into atraumatic versus toothed graspers. Johann's graspers is a good example of non-tooth or atraumatic grasper as shown in the diagram, which is useful in handling delicate tissues like bowels. A variety of toothed graspers in these slides, which are made available for better manipulation and retraction of a more resilient tissue, such as a gallbladder, which must be retracted catholically during laparoscopic cholecystectomy in order to demonstrate the critical view of safety during cholecystectomy. In terms of dissection, it can be performed via blunt and sharp technique laparoscopically. Maryland dissector is an example of a blunt dissector in which the dissection is performed by spreading the tissues apart with curved, tapered tips. Instruments like laparoscopic scissors and energy devices such as harmonic allow sharp dissection by dividing the tissues apart. Energy devices are preferred in view of their efficiency and hemostatic properties, as well as its safe use in patients with pacemaker as opposed to diathermy. One thing to know is that the energy device can generate extreme heat, hence caution of maintaining direct vision must be taken when using the instrument as well as with all other laparoscopic procedures. Lastly, adequate utilization of traction versus counter traction is crucial for safe and successful laparoscopic dissection, irregardless of the technique used. This is an example of a laparoscopic clip applicators to be applied to the edge of the tissue post-dissection. Whereas this is an image of an endoloop which is routinely used in laparoscopic appendicectomy. It is essentially a pre-tied reader's knot which is used to tie off the appendix prior to dissection. While it is true that laparoscopic surgery does offer minimally invasive solutions to a wide array of surgery, however, it does come with its own limitations which we are going to discuss. First of all is the limitation of vision. Laparoscope offers targeted, precise 2D image as opposed to the wide 3D view accompanied by close tactile feedback if need be, as we see in open surgery. As a result, laparoscopic surgery has a risk of iatrogenic injury by instruments if operated outside the field of vision. Next limitation is the poor depth perception due to the 2D image makes laparoscopic surgery challenging. The surgeon has to rely on other cues for depth perception, such as the light intensity, recognizing motion parallax, shadowing, or even learned memory. The good news is there is current development of a 3D technology which hopes to overcome some of these deficits. The inability to touch and feel tissues make it difficult to detect any tissue abnormalities, including the subtle ones with the loss of tactile sensation. There are also the challenges in gauging the actual amount of force needed to be exerted for efficacy while preventing any avoidable tissue injury during the laparoscopic procedure. The last limitation of laparoscopic surgery that we are going to discuss is the Fulcrum Effect. This diagram illustrates that the abdominal wall at the port site acts as a fulcrum, and as a result the instruments move in the opposite direction to the surgeon's hands, which may sometimes feel counterintuitive, hence showing why harnessing laparoscopic surgery can sometimes be a steep learning curve. We have finally come to the closure following laparoscopic surgery. The main objective of performing a port site closure is to prevent defects which could lead to port site hernias unless the diameter of the port size is 5 mm or less. Then suturing in this case is not required most of the time. It is important to recognize that there is always a risk of damaging underlying tissue during port site closure. Hence, it is important to lift the fascia away from those underlying tissues by using either a retractor or forceps. A J-shaped needle is preferred to aid closure due to the depth of the fascia from the skin surface. The next step would be the skin closure, which can be done via using absorbable single interrupted subcuticular suture or just with Steri-strips alone. Standard dressings are subsequently applied. And always remember, open surgery is not a failure. And with that, this marks the end of the video series of basic principles of laparoscopic surgery. Please fill in the feedback for us and tell us how we can improve next time, and let us know what you wish to see more in the future. And do check out the rest of our video presentations. Thank you very much, and till next time.